What's up, everybody? Dr. Mike here. And today we're diving into the fascinating world of electrocardiograms. Trust me, once you crack the code, they reveal a lot about what's going on with the heart. Whether you're in the ER, specializing in heart rhythms, or in primary care, knowing these patterns is essential. We'll break down each pattern step by step, highlighting the key features you need to know to nail your diagnoses. No more staring at those ECGs like they're written in a foreign language, so grab your coffee, get comfy, and let's get started. Alright, let's start with the basics. Before you can spot a problem, you gotta know what normal looks like, right? It's like trying to find a needle in a haystack without knowing what a needle even looks like. First up, we check the heart rate. This is the foundation of understanding an ECG. A normal resting heart rate sits comfortably between 60 and 100 beats per minute. This range is crucial because it tells us how well the heart is functioning at rest. Too fast, too slow, not good. Tachycardia means the heart is racing, while bradycardia means it's dragging its feet. Next, we look at the rhythm. The rhythm tells us if the heartbeats are regular or irregular. Is it regular, with those P waves showing up right on time before each QRS complex? That's what we want to see. Regular P waves indicate that the atria are contracting properly. Then we measure those intervals. These intervals give us a deeper insight into the electrical activity of the heart. The PR interval should be between 120 and 200 milliseconds. This interval represents the time it takes for the electrical impulse to travel from the atria to the ventricles. Any longer and we might be dealing with a conduction delay. This could indicate an issue with the heart's electrical system. And don't forget the QRS duration, which should be less than 120 milliseconds. The QRS duration tells us how long it takes for the ventricles to contract. Knowing this normal ECG pattern inside and out is like having a secret weapon. It equips you with the knowledge to quickly identify when something's off, ensuring timely and accurate diagnosis. Now let's talk about a true cardiac emergency, the STEMI, also known as a heart attack. This is one of the most critical situations you can encounter in the medical field. This one's a big deal, guys, and every second counts. Time is muscle, and the faster we act, the better the chances of saving heart tissue and ultimately the patient's life. The telltale sign of a STEMI on an ECG is ST segment elevation. This elevation is a clear indicator that the heart muscle is in distress. We're talking at least 1 millimeter or more in 2 or more contiguous leads. These contiguous leads are crucial because they help pinpoint the exact area of the heart that's affected. When you see that segment riding high, it means the heart muscle isn't getting enough oxygen. This lack of oxygen can lead to irreversible damage if not addressed immediately. Sometimes you might also see reciprocal ST depression in other leads. This is another clue that the heart is struggling and needs urgent attention. And keep an eye out for a new left bundle branch block. That can also be a red flag for a STEMI. This can sometimes be a subtle sign, but it's just as important. The longer that heart muscle is starved of oxygen, the greater the risk of permanent damage. Every minute that passes without treatment increases the likelihood of severe complications. So if you see those ST elevations on the ECG, you need to act fast. Immediate action can make the difference between life and death. Get that patient to the cath lab for immediate reperfusion therapy. Don't wait. The goal is to restore blood flow to the heart as quickly as possible to minimize damage and improve outcomes. Next up, let's talk about atrial fibrillation, or AFib for short. This is the most common arrhythmia out there, and it can really throw a wrench in the heart's rhythm. Instead of those nice, organized contractions, the atria quiver chaotically. On the ECG, the rhythm is irregular, and those P waves, forget about it. They're either absent or replaced by tiny rapid fibrillatory waves. Managing AFib involves controlling the heart rate, potentially restoring normal rhythm, and preventing stroke. Anticoagulation therapy is crucial for many patients with AFib. Managing AFib can be tricky, often requiring a team approach. Work with cardiologists to find the best treatment strategy for each patient. Ventricular tachycardia, or VT, is another serious arrhythmia. This one originates in the ventricles and can quickly become life-threatening. On an ECG, the first thing that will jump out at you is the speed. We're talking a heart rate greater than 100 beats per minute. And those QRS complexes? They're wide, often greater than 120 milliseconds. Another thing you might notice is AV dissociation. Treating VT is all about restoring a normal heart rhythm. This might involve medications or an electrical shock to the heart called cardioversion. Sometimes we even need to use a defibrillator if the VT is causing the heart to stop effectively pumping blood. The key with VT is recognizing it quickly and acting fast. Ventricular fibrillation, or VF, is the most critical arrhythmia. This is a full-blown electrical storm in the heart, and it's a code blue situation. On an ECG, it's pure chaos. The heart is quivering instead of beating effectively, and it can't pump blood to the body. VF is a medical emergency requiring immediate action. We're talking CPR and defibrillation, STAT. Let's talk about Torsades de Pointes, a type of ventricular tachycardia. This arrhythmia is known for its distinctive ECG pattern, where the QRS complexes twist around the isoelectric line. It's often associated with a prolonged QT interval. Several things can prolong the QT interval, including certain medications and electrolyte imbalances. Treating torsades often involves giving magnesium sulfate, and of course we need to address any underlying causes. Investigate the potential underlying causes if you see Torsades de Pointes on an ECG. Hyperkalemia, the potassium problem. This condition occurs when there is too much potassium in the blood, which can have serious effects on the heart. Let's talk about how electrolyte imbalances, particularly high potassium levels, can show up on an ECG and what they mean for heart health. First up, hyperkalemia, or high potassium levels. Potassium is found in many foods such as bananas, oranges, and spinach, and is essential for normal cell function. Potassium plays a crucial role in regulating the heart's electrical activity. It helps maintain the proper function of the heart's muscle cells and the transmission of electrical signals. One of the earliest ECG changes you might see with hyperkalemia is peaked T waves. These are tall, narrow waves that indicate the heart's electrical system is being affected. As potassium levels rise further, the QT interval can start to shorten. This interval represents the time it takes for the heart's ventricles to contract and then recover. If hyperkalemia isn't treated, you might start to see the QRS complexes widen. This widening indicates that the electrical impulses are taking longer to travel through the heart muscle. In severe cases, the ECG can progress to a sine wave pattern, a pre-arrest rhythm. This is a critical condition that requires immediate medical intervention to prevent cardiac arrest. Treating hyperkalemia involves several steps. It's crucial to act quickly to prevent the condition from worsening. First, stabilize the heart's electrical activity with calcium gluconate. This helps protect the heart while other treatments are administered. Then, shift potassium back into the cells with insulin and glucose. This combination helps lower the potassium levels in the blood by moving it into the cells. In severe cases, dialysis might be needed to remove excess potassium from the bloodstream. This procedure filters the blood to remove the excess potassium and other waste products, helping to restore normal levels. Just like high potassium can cause problems, so can low potassium, also known as hypokalemia. When potassium levels drop too low, it affects the way the heart repolarizes. One of the hallmark signs of hypokalemia is the appearance of U waves. Another common finding is flattened or even inverted T waves. You might also see ST segment depression and a prolonged QT interval. Treating hypokalemia is usually straightforward. Replenish the body's potassium stores. This can be done with oral or intravenous potassium supplements. Correct potassium levels slowly and carefully, monitoring the ECG closely. Correcting potassium too quickly can actually cause other heart rhythm problems. Let's talk about pericarditis, when the pericardium becomes inflamed. Pericarditis can be caused by viral infections, autoimmune disorders, and certain medications. One of the classic ECG findings in pericarditis is diffuse ST segment elevation. Unlike in a STEMI, you'll often see it in multiple leads. The ST segments often have a concave upward shape. You might also notice PR segment depression in multiple leads. Diagnosing pericarditis involves putting together the ECG findings with the patient's clinical presentation. Patients often complain of chest pain that's sharp and pleuritic. The pain is often relieved by leaning forward. Let's talk about pulmonary embolism, or PE. This is a serious condition where a blood clot travels to the lungs and blocks an artery. While the ECG isn't the primary diagnostic tool for PE, it can provide some valuable clues. One of the classic ECG patterns associated with PE is the S1Q3T3 pattern. This involves a deep S wave in lead 1, a Q wave in lead 3, and an inverted T wave in lead 3. Other ECG findings that might make you think of PE include sinus tachycardia and right axis deviation. Diagnosing PE usually involves a combination of clinical suspicion, imaging studies like a CT scan, and blood tests. If you see these patterns, raise your suspicion for PE. And there you have it, the 10 ECG patterns every doctor should identify. Mastery of these patterns enhances patient care and outcomes. Quick recap: normal ECG STEMI atrial. Fibrillation, ventricular tachycardia, ventricular fibrillation, Torsades de Pointes, hyperkalemia, hypokalemia, pericarditis, pulmonary embolism pattern. Review ECGs regularly and stay updated with current guidelines. If you found this helpful, please like and subscribe for more educational content. Keep learning and stay proficient.